Hi, everyone. Thank you for joining us. I'm really excited to be here. So my name is Abha Rai, and I am an assistant professor at the School of Social Work, Loyola University, Chicago, and also the associate director for the Center for Immigrant and Refugee Accompaniment within the School of Social Work. And I'm also a fellow at Curl. So I'm really excited to be here and chat with you all today. My area of research interest broadly actually relates to the topic that we're presenting on today. So my focus is immigrant and refugee well-being with a sub-focus on domestic violence and gender-based violence across minority communities. Thank you.
And good morning. I will be presenting along Dr. Rai. My name is Igar Lamse. I am a first-year doctoral student at Loyola University School of Social Work. And my research interests include poverty reduction, social welfare policy and practice, and violence against women. I'm happy to see everyone, and I look forward to sharing what we have today with you.
So the topic for presentation that we're going to be focusing on today is the physical and emotional impact of COVID-19 on immigrants, with a sub-focus on health and policy implications. So basically, we'll be presenting some of our findings from two studies that we conducted during COVID. We collected primary data utilizing surveys. So we'll mainly focus on sharing our findings from that study, as well as talking more broadly around the implications of our research, as well as implications for practitioners and for educators. Next. We will begin by talking a little bit about who immigrants are. So we'll get into specifics around who immigrants are, where they come from, how long they've been in the US, so on and so forth. And then we'll specifically move on and talk a little bit about the impact of COVID-19 on immigrants. Then moving on, we'll talk about health and policy implications. And then, like I was sharing previously, we'll talk about the role of researchers, educators, and practitioners. And then we'll have ample time for questions toward the end. But if, this is really informal, so if you have any questions, pressing questions, anything like that, as we're speaking, please feel free to share via chat or raise your hand or anything that feels comfortable to you. Next.
Thank you. To provide some context on the COVID-19 pandemic, as you all know, the year 2020 up until now has been hard on all of us because of COVID-19 and all of its variants. In the US alone, we've had more than 939,000 deaths as of today, and more than 78.5 million cases. And looking at the 28-day period starting from February 23rd, a total of 64,314 days were registered, which is a very large number. Although the numbers seem to be going down, and the government is loosening its preventive measures, like lifting up the mask mandate. All communities continue to be impacted by COVID-19. But since the first case was announced in the United States on January 2020, immigrants have been impacted more severely than non-immigrants for various reasons, the detail of which will be discussed later. But first, I will provide some overview of who immigrants are in the United States and what their composition looks like. Next slide, please. According to data by the Pew Research Center, there were more than 48 million foreign-born individuals in the United States in 2015. And the number is expected to reach more than 78 million in 2065, which is a very significant number. Among top birthplaces for immigrants in the United States, Mexico covers more than a quarter, followed by China and India. At the time of data collection, more than 1 million immigrants arrive in the United States each year. And during the pandemic, more immigrants worked as frontline workers in the healthcare center and in the healthcare sector and many other sectors. The next slide, please. To put this into a demographic and this demography into historical and geographic context, in 2018, the immigrant share from the United States population reached an almost historic high, and the number has been on and up since the 70s. The share of immigrants from the United States population has been growing, constantly growing, and by the year 2065, that number is probably going to eclipse the middle balance. And when we look at the spatial distribution of immigrants in the United States, we can see that the coastal big cities host some of the largest immigrant populations in the United States, with New York, Los Angeles, and Miami hosting a significant immigrant population. Next slide, please. We can see in this graph a more detailed look at the composition of the immigrant population in the United States, consistent with what was presented earlier. More than 25% come from Mexico, followed by China, India, Philippines, and El Salvador. Slightly more than half the immigrant population comes from multiple countries. This data is based on 5-year estimates done during the 2019 US Census. Dr. Rai will put the conditions of immigrants in the context of the pandemic and political administration. Dr. Rai, please take over.
Thank you. Next slide, please. So when talking about immigrants in the US, it's important to think about immigrants in the context both of COVID-19 as well as the Trump administration that was in effect for the past few years. So the positionality of immigrants was severely impacted by both these aspects. And a lot of research that exists out there also says that for immigrants, it was almost like they were going through dual pandemics, one of COVID and one of the administration. So I say this just to sort of set the stage for the rest of the conversation during this presentation. So we've said and we've read extensively that immigrants have been disproportionately impacted both by the pandemic and the administration. During COVID, a lot of immigrants were highly represented in frontline jobs. So if you look at the statistics, about 22% of nursing assistants, 29% of housekeepers, janitors, etc., in the healthcare industry were actually immigrants. So that they didn't have the opportunity to stay home and not actually go into jobs. Depending on the migration status of immigrant communities or immigrant individuals, some were actually eligible for unemployment and a lot of them were not. So a lot of them may actually be forced to go into work without opportunities of health insurance or getting care, etc., in case they were sick. Next. Some other challenges that we also sort of heard about happening during the pandemic was domestic violence becoming higher because people were restrained in their own homes during the stay-at-home orders. People were maybe forced to spend time with their abusive partners because of the stay-at-home orders. There's research that kind of says that calls to domestic violence agencies have gone up and have gone down. There's also reports that say that a lot of shelters had to turn back people because they didn't have enough space to actually allow for social distancing during COVID, etc. And then there might have been a lot of fear in general among immigrants to get tested because of their visa status and experiencing or facing deportation, etc. So this is also another reason why COVID-19 in particular was challenging for immigrants. Next. So as we continue to talk about COVID-19 and Trump administration and the impact on immigrants, there were a lot of other factors that were also sort of at play. So a lot of undocumented individuals in detention centers were unable to socially distance. And we've seen and heard a lot about this through newspaper articles, I apologize, media clips, so on and so forth. The living condition of immigrants also makes them more prone to health risk compared to non-immigrants. Maybe they're living in smaller spaces where they don't have the opportunity to actually socially distance, etc. The policies around, the travel ban, the Muslim travel ban was also harmful for immigrants because a lot of them experienced extreme stress due to isolation and not being able to provide for their family or meet family members during the past few years. There were constant threats by the president and the administration about building a wall and creating separation between the US and Mexico. There were multiple visa bans that led to people being separated from the US and families in the US and actually, being halted in their home countries. There were bans around work visas where H-1 visa holders were not allowed to come back to the US. So family separation was actually, for a year or longer in a lot of immigrant families. Also, there were racist remarks that were made at several rallies. One that distinctly stands out to me was calling the COVID virus Kung flu, and all of these things that started around the first rally in Tulsa that happened during the presidential campaign. And then there have been constant threats to end DACA, and the cap for refugees was actually limited to 15,000. Next. So looking at what's happening right now, there's definitely been some sort of improvements. There's slightly more positive climate right now under President Biden. The cap for refugees in particular has gone up from 15,000 to 60,000. However, Title 42 still continues to stay in effect. There were conversations around getting rid of Title 42, but it still continues to stay in effect. And a lot of times it also leads to family separation. USCIS continues to be backlogged, because of which visa processing for H4 visa holders, H1 visa holders, etc., is delayed. Green cards and permanent residency for immigrants is also delayed. Next. There's a video that I will play now, and I can play it from my screen, Teresa. This will give you a snapshot around immigrants and their experiences. So let me quickly play that for you.
So it's finally happened.
That thing you were afraid of.
Something's come from overseas and taken your jobs.
Made it unsafe to walk the streets.
Kept you trapped in your home.
A dirty disease.
Your proud nation gone.
But not me.
Or me.
Or me.
Or me.
No, you clap for me now.
You cheer as I toil.
Bringing food to your family. Bringing food from your soil.
Propping up your hospitals.
Not some foreign invader.
A devoted driver.
Teacher. Lifesaver.
Don't say go home.
Don't say, not here.
You know how it feels for her to be a prison.
You know how it feels to live in fear.
So you clap for me now. All this love you are bringing.
But don't forget when it's no longer quiet.
Don't forget when you can no longer hear the birds singing.
Or see clearer waters.
That I cross for you.
To make lives filled with peace.
And bring peace to your life too.
Come, all you Gretas, you Malalas,
You immigrants.
see what we have learned
It only takes the smallest thing.
to change the world.
So this was sort of, this video was made in the context of immigrants living in the UK, but it holds true even when we think about immigrant communities here in the US. I want to just take a moment if possible and see if there's any sort of reactions to the video. Well, hopefully everyone's still thinking about it. We can circle back toward the end and chat a little bit more. Teresa, if you can please help us with the slide share again. Thank you. Next. So research, when talking about research in general during COVID-19 and with immigrant communities, there's been a lot of challenges in conducting research. And this is because of the pandemic. Obviously, a lot of people were at home, so it was difficult for them to take part in any type of interviews or anything like that, travel to shelters, or even leave their homes. Again, a lot of people may or may not have access to online technology, so doing any type of surveys was again challenging. There's also limited trust in the research process with immigrants in general. And it could be because, if there's questions around immigration status, etc., they may be afraid to answer those questions because of fear of implications that, disclosing any information may have on their visa status. There's generally an unclear understanding of benefits through the research process. So it's important for researchers to sort of partner with community organizations and really clarify the sort of role of participants and the importance of research. And there's ongoing stress and trauma that immigrants have experienced extensively during COVID-19, as well as the past administration, which may have reduced their likelihood of participation in research. Next. Despite some of the challenges, we were actually successful in collecting some data. So we conducted 2 studies, like I'd mentioned at the beginning. Our 2 studies were surveys, and our sample was 400 plus in both of these different studies. I'll talk about the specific questions and findings of these studies in the next couple of slides. In terms of our main methodology, the surveys were self-administered. So we just provided them the link and they were to answer those questions on their own and just hit submit. We used non-probability sampling. So we used convenience sampling by sending out the survey information to individuals in our own networks, through community partners, etc. And also we use quota sampling through the use of Qualtrics research panels. We actually contacted them and they were then able to send out our surveys within their network. We use both community and Qualtrics panels for data collection. In terms of eligibility criteria, we had individuals that were 18 or older, foreign-born immigrant, or child of immigrant parents, so that we could also have second-generation immigrants. They had to be currently residents of the US, and the data collection was conducted over a period of roughly 4 weeks. And this was during early COVID. So it was conducted during early 2021. Next, please. So our 2 studies, the first one was about COVID-19 and its impact on immigrant well-being. And the second study was COVID-19 Trump administration and stress experienced by immigrants. So they might seem similar, but the focus of the first one was the impact of COVID in general and the stress experience. But the second one was in particular about the Trump administration and stress experienced by COVID in relation to the Trump administration by immigrants. Next, please. So for the sake of time, we'll present some partial findings from both of our studies. And in the end, I'm happy to answer additional questions, or if you'd like more in-depth information around our methodology or anything like that, please ask. So for the first study, the main research question that we will present today was that what types of domestic violence victimization do immigrants report experiencing during COVID-19? We collected data on domestic violence as one of our key variables. And then the second question we had was, what types of biopsychosocial factors impact domestic violence victimization during COVID-19? And we used the biopsychosocial framework to sort of look at these different biological, psychological, and social factors impacting domestic violence. Our independent variables in this study, or some of the independent variables in the study, were gender, age, race, mental health, stress, generational position, and family connections. And our dependent variable was obviously domestic violence victimization. Next, please. So our sample for the first study was 419 individuals. We had somewhat of a good distribution racially. So we had about 31% that were white, about 34% that were Asian Pacific Islander, about 16% Black, 14% Latin or Hispanic, and others were about 5%. The others category also included individuals who identified with two races or identified as being like multiracial. We also had a good distribution, which was really nice in terms of gender. So we had almost half and half. Women were obviously slightly higher, but it was somewhat equal. Our age ranged from 18 to 94, which was really wide. Our mean age was about 49 years old. And in terms of generational position, again, we had a distribution across first generation, 1.5 generation, and second. I'll briefly explain what first, 1.5, and second is now. First generation actually includes individuals who came to the US at age 13 or later. 1.5 includes individuals who moved to the US before age 13 or were born in the US. And second generation includes people who were born in the US but may have one or more parent that immigrated to the US. So that's sort of the difference. I know it can be a lot and it can be confusing. So if you have any questions or if we'd like to revisit this, we can definitely do this. Next, please. So this was really interesting to see. We had about 35.1% of men in our sample and 28.3% women in our sample experienced domestic violence victimization. So it was interesting to see that men actually were higher in numbers when talking about domestic violence victimization. We used a standardized measure to collect data on DV, but the standardized measure did not have questions around immigration-related abuse. So we added a few questions specifically important for immigrant communities like immigration abuse. We included questions around emotional abuse, and we had questions around sexual abuse as well, which was not present in the main scale. So if we look at physical abuse, verbal, emotional, immigration, financial, and sexual, and we look at the number of men and women that experienced it, the numbers are not that far apart. If we go down for physical, we had 24 men versus 23 women. For verbal, we had 49 men and 56 women. And if you scroll down the list, the numbers are really not that far apart. For sexual, actually, victimization experienced by men was higher if we just look at the frequencies or just the numbers in comparison to women. Next, please. And we also ran a logistic regression. We actually did a 3-step logistic regression for our study. So our dependent variable domestic violence was measured dichotomously. 0 was no experience and 1 was experience of at least one type of domestic violence victimization. And there were 7 types in the actual domestic violence questionnaire. We ran 3 types of logistic regression. The first one only included biological factors. The second model included biological and psychological. And then the third one included biopsychosocial, based on the biopsychosocial framework. For the sake of time, I'm just presenting our third model here, which is the full model. And if you have questions about the others, I'm more than happy to answer. So in the full model, we saw that gender was statistically significant, age was statistically significant, mental health, and also when we go to the next slide, we'll see that family connections was also statistically significant. So for gender, we saw that women had a lower likelihood of domestic violence victimization. People who were older had a lower likelihood of domestic violence victimization. And for mental health, we saw that people with more mental health concerns or that reported more mental health stress, they had a higher likelihood of domestic violence victimization. Next, please. And this is the one that I was talking about, family connections. So the question was if people were unable to continue family connection during COVID-19, and we saw that people in the sometimes and always category had a higher likelihood of domestic violence victimization as compared to the ones that were in the never category, which sort of just talks about the fact that people that experience social isolation were more likely to experience TV victimization. The model explained about 27% of variation in the dependent variable, and we already talked about how domestic violence was measured. Next, please. So our next study, the main focus was descriptive. So we did not run any type of logistic regression. It was descriptive. The main study variables that were included were region, generational position, race, education, employment. We had some specific COVID-related variables, and we had some variables that were Trump-era policy stress, which was measured through the PSS. And we have some questions around travel impacts during the Trump administration. The goal really of this study was to provide an overview of the experiences of immigrants during COVID under Trump administration. From this data set, we've already published some regression-based models as well. But for today, I will just focus on providing some descriptors. Next, please. So again, in this study, we saw a fairly good distribution in terms of our sample based on region. We had people from the West, South, Northeast, and Midwest. Good mix in terms of generational position as well. Almost half and half first gen and second gen. In this study, we actually combined the 1.5 and second generation. That's why there's no 1.5 here. For gender, we actually had a higher proportion of women compared to men when looking at the previous study. And again, fairly good distribution in terms of race, similar to our previous study. In terms of employment, we had about 40% or 39% people that were employed full-time, about 21% that were retired, and then there were others belonging to other groups, which included like part-time students, people that were not employed or were homemakers. And in terms of education, we also had people that had college degrees or advanced degrees, and then we had some that just had technical degrees or technical certifications, and some that reported having no education. Next, please. So this is what I mean when I said that I will only be we'll only be reporting descriptive findings. So if we look at questions around experience of COVID, we did have about 12% people that did say that they experienced COVID personally. Second, when we asked them if people experienced COVID in the family, we had around 32% that said yes. When looking at COVID death in the family, we had 41% people that said yes. And job loss during COVID, we again had about 31% people that said that they experienced a job loss during COVID, or they got laid off or lost their visa status, etc. And in the end, lost their job because of COVID. Next, please. When looking at stress due to COVID, we had a lot of people say that they were stressed to a moderate extent or to a great extent when thinking about COVID. Willingness to get the vaccine, we had a good proportion of individuals who had already received the vaccine, about 54%. And this is back in 2021. So the numbers are actually quite good in terms of vaccination. And then we also had people who were interested in getting the COVID vaccine, which again is a positive sign. Next, please. And now thinking about, how often they felt that they were unable to control important things in life. The prompt before that was related to the context of Trump administration. So the responses are specifically about that. So we did have a lot of people say that they were fairly often and very often stressed about being able to control things in life. Similarly, the next question was about their ability to handle personal problems. Again, we had people in the almost never and sometimes category, high numbers, that said that they were not confident about handling personal problems. Next, please. And then some other questions were about people feeling stressed that things were not going their way. We had people in the fairly often and very often category, lesser than some of our other questions. And then the next question was again about stress in relation to, these questions were also in relation to the Trump administration. So how often have you felt difficulties were piling up so high that you could not overcome them? We had a lot of people in the sometimes and fairly often category as well here, which was really shocking. And then finally, the next set of descriptive results were around the questions around not being able to either see their family or being impacted by the travel bans. So we had questions around if people had difficulty re-entering the US. So we had about 16% people who said yes. Family members difficulty, we have had about 28% people who said yes. And then going back to native country, we had around 28% people who said that yes, they did have difficulty. When thinking about these numbers are still somewhat high, but it's not like 50 or 60%. And some reasons for that could be that a lot of people may be already living here with families in the US. So maybe that's why they're not traveling back to their home country, or people are not leaving the US and traveling outside of the US because most of their family has lived in the US for a few years. Next, please. So finally, I've talked a lot about our study results. We'll try and put it all together, and in the next few moments, we'll talk about some implications and pause for questions. So if we're thinking about all of our study results, we did see that domestic violence experiences and stress in general was high among immigrants. Stress was high during Trump administration as well among our sample of immigrants. And based on both of our studies and our data sets in general, including some other questions, we were able to see that or demonstrate that immigrants were definitely severely impacted during sort of the dual crisis of Trump administration and COVID-19. It was also interesting in our domestic violence study to see that men actually experience domestic violence at a higher rate compared to women, which was really interesting and new. There's not a lot of research that talks to that difference when looked at by gender. Next, please. Our studies had some limitations, which is important to highlight. Every research has limitations, and I think a good strength of a research study is to definitely be transparent about limitations. So I'll try to do that now. All of our study was, or both of our studies were cross-sectional, meaning data was collected at one point in time, so it was not longitudinal. So we were not able to really, through a cross-sectional study, you're not able to demonstrate cause and effect because all of the data is just collected at one point in time. There's more need in the future to examine differences by country of origin, especially when thinking about questions of travel ban stress and stress experienced during the administration. All of our surveys were self-reported. So with self-reported surveys, there could be problems around bias or people not remembering correctly the stress that they experienced, or incorrectly understanding questions because they did not have the opportunity to actually reach out to us or contact us and seek clarification, which may have been a possibility if all of this was conducted through interviews. And then finally, the data was collected after President Biden came into power. So it is possible that maybe the stress experience could have gone down significantly, and the responses in the surveys may have been impacted by that change. So all of our study findings should be interpreted or understood in the light of these limitations. Next, please. So in thinking about some policy implications of both of our studies, we feel that stimulus checks are important to be made accessible to all immigrant communities or all immigrant individuals as well. A lot of immigrants did not get stimulus checks, maybe because they were not eligible to receive it. There need to be stronger and cleaner pathways to citizenships around providing more opportunities for individuals to actually get a fast track path or be on a fast track path to citizenship. There have to be more state benefits for individuals on immigrant visas, which could be in the form of money or any other benefits that could be offered to them. It's important for both H1 and H4 visa holders to have independent work visas. So just to provide context, H4 visa holders are actually on dependent visas whose visas are related to the H1 primary visa holder, which is usually the spouse or usually the male partner. So H4 visa holders actually are responsible for the H1 visa holder within the first 3 years of moving to the US for their driver's license, the bank account, health insurance, everything. So they don't have the opportunity to actually have anything independent and just for them. So it's important that we set these differences and provide equal access to both. There should be more awareness of the Violence Against Women Act for both men and women, because clearly in our sample, we were able to sort of demonstrate that men were also experiencing victimization. So it's really important to have these conversations or make this policy more accessible. And then it's really important to also think about culturally responsive service intervention funds. The Violence Against Women Act made a small amendment a few years ago. I believe it was in 2013, where money could be allocated towards building culturally responsive interventions. And this money was available to NGOs or community-based organizations. So it's important for CBOs to make use of this fund and come up with interventions that are actually different from the standardized interventions, which may or may not be applicable to immigrant communities. And it's also important to think about U visas. So U visas actually can be applied by survivors experiencing domestic violence in the event they're seeking separation and trying to get their own visas. So currently there's a cap on U visas for only up to 10,000 visas a year. This visa can also be received by survivors themselves and or family members of those survivors. So looking at the prevalence rates and looking at this 10,000 number, there's a huge gap. So the 10,000 number either needs to go up or there needs to be no cap so that survivors actually have the opportunity of getting U visas and being able to come out of their abusive relationships. And this can happen if there are more either independent visa options for them or the opportunity to actually get the U visa irrespective of the cap. Next, please. Now I will hand it over to Yegermal.
Thank you, Dr. Rai. Looking at the implications for higher education, especially for social work education, one thing we've learned from these studies is that social work students can play a stronger role in addressing the intersectional needs of immigrant communities, immigrant clients, and that can be done in various ways. Of course, students don't really have the platforms to do as much as they would and they could compared to practitioners, but there are many things that can be done in their capacity as student practitioners and in their advocacy efforts as well. And social work programs need to be training students to better respond to issues like domestic violence, mental health concerns, and others faced by immigrant communities. our training manuals, our curriculums need to be considerate of the need and the demand for these services and prepare students accordingly. And of course, there is the need for helping students become more culturally responsive. That can be achieved in many ways. One is through exposure. Another one is through creating platforms within and outside schools for students to have a better understanding of how different communities, different cultures operate and receive service, and how their intersection with service provision affects them. And macro level advocacy for immigrant policy reforms is one way students can be engaged in, because students have annual advocacy programs. So advocacy for better immigrant rights, immigrant services can be one avenue they can take. And there is a need to move away from the one fits for all approach. There is more on that in the next slides. Next slide, please. What can we do as researchers? As researchers, one of the things we can do is partner with practitioners and community-based organizations. In this regard, one thing we need to give more attention to is practitioner-generated knowledge, which doesn't always make it to published journals, but nonetheless is very important. And engaging practitioners not only as data providers, not only as study participants, but also co-researchers, and using their platform to engage with service recipients in the research process is also very important. Community-based organizations have a similar importance, and as researchers can use better approaches that maximize the participation and actual power of their study participants, and community-based participatory approaches are good in that regard. And that starts with identifying and formulating research problems, utilizing more practitioner-generated knowledge, and engaging participants as co-researchers so that they can assume more responsibility in the whole process. We can use innovative methods online and in other ways as well. We have more in the next slide. In some countries, researchers used photographs as data collection tools. In some countries in Asia and in Africa, some communities were given cameras. Women were given cameras, so they can use those to represent their feelings, their daily routines, and their experiences. And the results that came from those studies were very interesting in many ways. Next slide, please. Researchers need to recognize, not just on paper, but also in practice, that one size does not really fit all. And this is especially true for individuals who occupy several roles in a community because of their identities, multiple identities, race, disability, nationality, gender, sexual orientation, and so forth. So we have to be mindful of the different status and roles people occupy in their lives, and make sure that all of these are addressed in our practices, and social workers practicing need to be mindful of this as well. Next slide, please. Practitioners need to be better engaging with immigrant communities. Again, community-based organizations and informal groups can be very useful points of interest. We know from previous studies that a lot of violence remains unreported among immigrants. So at other times, immigrants don't know where services are available, or that they are entitled to some services to begin with. So by engaging with community-based organizations and informal groups, we can increase access and we can increase awareness as well. Practitioners need to be able to assess domestic violence in ways that are culturally responsive, and culturally responsive assessment modalities are more likely to uncover forms of coercion and abuse that are not usually detected by mainstream assessment modalities. We need to provide timely response and appropriate services for immigrant clients and communities. One good example can be recent immigrants from Afghanistan. We have several immigrants from Afghanistan in Chicago. The city wasn't prepared at all to respond to the needs of these immigrants. And what we can do is anticipate when and how needs might arise, because we know from experience that there are always going to be needs, and plan ahead and work with local communities and the immigrant communities themselves. And we need to advocate for independent visa options for immigrants, which is one point Dr. Rai was touching upon. And we need to create awareness, make immigrants aware of the provisions of the Violence Against Women Act. Next slide, please. With that,
Yes, thank you so much. Teresa, we can actually stop the slide share now. So what I'd like to do now for a minute is invite everyone to kindly unmute themselves. You can still be off video if you like, but please unmute yourselves. And if I ask a question and if you're comfortable, please respond to it. So अभी तक मैंने जो भी बोला आपको, आप लोग को समझ में आया? मैं इतने देर से आपसे बात कर रही थी अपने रिसर्च के बारे में, तो आपको समझ में आया? So what do you all think? Any thoughts on what I just shared? Well, no, because I was talking in Hindi and you all probably did not understand. The point being is here, the important message is about culturally responsive intervention. So this is what happens if we try and use an instrument or a technique that's not culturally responsive to immigrant communities. They're not going to respond, or they'll just be shocked and they won't understand. That's why this whole point being one size does not fit all. That's why it's really, really important to, yes, someone understood. Any Hindi speaker here, you will definitely understand. But for others, I think as researchers, practitioners, educators, it's really important to think critically about this idea of cultural responsivity and making sure that we're able to provide to the community exactly whatever it is that they're needing and looking for. That is all from us. If there's any questions or any dialogue that we'd like to have at this point, I welcome all of that. And thank you all for listening.
Yeah, so I'm just a little unclear. First of all, thank you for the study and bringing out those points. But coming from a community perspective, in a mostly like 90% Latinx community that is so close to Loyola, which Loyola University is within miles, and that's where I go. So I'm a little confused in the presentation and how it's really impacted my community. Because I was when the COVID, well, was it not a pandemic, it was an epidemic. And I reached out to several folks to try to get some education to our community, because I knew, one, being a large Latinx undocumented community, two, being an environmental justice community, and three, being a low income community, I knew, and then the other was the majority of essential workers, which most of their time is at work. So I have contacted quite a few folks in regards to education, and I could not get a commitment from anybody when it was an epidemic. There was a lack of education at the beginning. And so that actually, Cicero, Illinois, which has actually been a hotspot for COVID-19. And the local government, but I believe if we would have had the education before there was actually became a pandemic, an epidemic, and I reached out to quite a few public health places like CDC, the Cook County Department of Public Health. At Loyola, I finally found someone called Circle, which I've been sort of involved with to make sure that they address some of the essential worker needs, like to make sure that essential workers were getting vaccinated at the workplace. So Circle did participate in one of those with Black Workers Matter and Beambo. But there's so many, I think things that could have been prevented and starting off with education, which was not given to our low-income communities, immigrant communities. And so we were basically left, to fence out for ourselves and people dying. And, we were just fearful and we didn't know what to do. We couldn't go to our place of worship. And so that's why I'm a little bit confused in regard to the study and what actually has happened in communities like mine, which is an immigrant community, and where I think Loyola could have done much more. And because Loyola University here in Maywood, we have all the west suburbs here, and I think they could have done much more than what they have done. I think they've done very little in regards for the immigrant community. And because, it's because we have, like I said, the west suburb, we have Cicero, Berwyn, Melrose Park, Maywood, all these communities in the west suburbs where, full of essential workers. So I'm just a little confused. And then just because what I've seen too in our school systems, they still practice a lot of the school to prison pipeline, which, of course, increases mental health status. In Cicero, they created another actually alternative school for elementary ed, instead of including, additional resources for mental health. You use a punitive model and open up a new, alternative school, which is very punitive for our kids. So so I'm a little confused. I mean, a friend of mine, introduced me to what was happening today, but I'm just a little confused is that a lot of the things that you all mentioned, it's kind of like disconnected with me of what I've seen and what I've experienced here in my community, and especially with long-term facilities as well, and abusive long-term facilities that have neglected folks, older folks, elderly folks, disability folks. And I understand there's a shortage, but is there really a shortage? It's because of lack of pay and profit. So in my eyes and what I've experienced, and still and to this date, it's profits over lives. And how do we change the corporate America model and colonialism mentality to stop, profits over life? So I think I'll end it there.
Well, thank you so much. I know we have a lot of people here. Christine, David, would you all like to respond, or would you like me to?
I'll let you take it away on the study. I'll just say, Adelia, couldn't agree more. The federal government, local governments, and dear old Loyola U could have done much more, and something we continue to challenge ourselves and our colleagues on. So, but I think the heart of the question is really kind of making the connection between Delia's community and some of your thoughts on that, when it comes to the research portion of this.
Mm-hmm. Yes. Well, first of all, thank you so much for providing your honest and candid feedback and sharing your thoughts and opinions. I am really so humbled by this conversation. I do think this is really important. So just to sort of clarify our study, we did not specifically collect sample from Loyola or with Loyola as a focus in mind. The sample was really collected in collaboration with actually several other universities, including University of Tennessee. So we did have sample from Tennessee. Another study we had sample from Utah. So it was a pretty national sample, and the goal was to understand the experiences of immigrants broadly during COVID-19. So our sample was across the US. When the study was done, it wasn't done with a particular focus just on Chicago or just within the Loyola community. But having said that, I do agree with what David, started or shared with us briefly, is that I think it's important for us to think about, doing more for the community and definitely constantly challenging ourselves. So I really apologize for the experience that you had and, the education that you were trying to sort of get access to. I do feel that if you were able to get access to that, or if individuals that you contacted were more responsive, it would definitely have been more helpful. We can connect offline, and if there's anything that I can personally do to support, or we have the Center for Immigrant and Refugee Accompaniment within our School of Social Work. If we can do something, I'll be more than happy to assist, work with you, anything of that nature. In terms of what we've actually done using all of this research, we're doing presentations like this. We're working with community organizations in the Chicago area and are talking to them about the findings of our study and the implications it can have. So some such organizations have been Sanjeevni, which is again in the Chicago area. We've had conversations with Apna Ghar, again, a Chicago-based organization. We're also in the process of working with something that Yigarmal mentioned, working with Afghan refugees. And we're having some conversations with community organizations here in the Chicago area, as well as in Tennessee, to be able to work with community partners that are currently receiving Afghan families and provide support to them or any education. And we're also actually, coincidentally, we're working on an educational module that we can share with staff members relating to compassion fatigue that they're experiencing as they continue to work with these families, and also for participant individuals at these different agencies regarding their experience of COVID, transition, so on and so forth. So in terms of our actual implication, like, so what, we have this data, these are our findings, now what happens? These are some of our next steps. We concluded our data collection in 2021, but our analysis and reports, etc., are just starting to come out now. So this is actually one of our first presentations that is happening. And over the past few months, and even looking in the future, the plan really is to go back to community agencies, present some of our findings, and talk about how we as researchers can actually fulfill the needs within those agencies. So I hope this was somewhat helpful. I can't go back in the past and change some of your experiences, and I'm sorry about that. But I hope this was helpful in providing you a little snippet into what the future with this research looks like. And my offer still stands. If there's anything I can do personally, please reach out to me. Thank you.
Any other questions? Christine, I think you might have had something, and you're muted.
Yeah, I mean, clearly, in terms of looking at the domestic violence piece, and the large number of reports of domestic violence by both women and men, and as you said, I mean, men were a lot more, and then also knowing that if you look at people seeking assistance for domestic violence, that the number of men who seek assistance, in terms of going for orders of protection or going into the court or seeking services, which admittedly are more designed for women, is very low. So, I mean, it's just the whole question of, is there something unique about an understanding or the experience of family violence in the immigrant community? And as you said, looking at it nationally, is it driven by certain nationalities rather than others? I'm just, it's just a really interesting finding.
Susan.
So just to jump in, because I worked with this data a little bit, and I was also equally surprised by the findings. You know, I have my own theories about this, and I haven't tested them out, and I've talked with Abba about some of them. And, you know, I think that interestingly, when I was doing the literature review for this article, there are places where men and women do not differ that much in terms of rates of abuse nationally. So that's not totally surprising. I mean, like emotional abuse, for example, is pretty similar for men and women. And I mean, I think, and there's probably also types of abuse that are unique to the community, like in-law abuse, for example, or immigration-related abuse that also probably may account for some of the variation, although, you know, looking at the table, that's not necessarily the case. But I also think, I mean, you know, our measure of abuse is very broad. We collapsed across categories. I mean, I do think, you know, there's certainly abuse of men going on, and it clearly is related, you know, being male is definitely related in the study to the likelihood of abuse. But I think, you know, there's probably more analysis that's needed to look a little bit more closely at it.
Yeah, I agree with Susan that we definitely need to do more in-depth analysis. But I will say, I think this is the second study that I've collected with men and women looking at domestic violence in particular. And the first one was just with South Asians, which was for my dissertation. In that study, I did not find men experiencing more violence in comparison to women, but the numbers were pretty close, especially looking at immigration abuse and in-laws abuse, which is what we also kind of saw in this study. So that was really interesting for me. And again, in terms of going back to, you know, what you were saying earlier, Christine, about, you know, access of services, etc., I do think that it's a problem, especially I'll just talk about, you know, my Indian background. I don't know if this is true for every single Indian person or every single immigrant communities, but, you know, this idea that boys don't cry, it's true. Like it happens in a lot of our households, and that's something we kind of grow up with. So, you know, if you have to do like something in the house, okay, let's just give this to the girl. And, you know, for boys, go out and play. You know, why are you crying like a girl? I've heard this so many times. And I think that that's the, you know, this messaging is a problem. Like that needs to change. So I feel like if we're able to do some type of, or engage in some type of cultural shift around that, I feel like men will at least have more opportunity without feeling embarrassed or, you know, unnatural about sort of seeking help and reporting victimization. So Susan and I were working on another project to, you know, sort of around cultural attitudes, and Christine obviously knows that project too, the Bystander Intervention. And in that, our goal is to sort of create more awareness around balanced gender role stereotypes, and I guess like getting rid of archaic, older cultural norms that may be harmful to a particular set, and trying to make sure that domestic violence is a conversation that at least happens in the context of men and women and not just a particular group.
Other questions?
Well, I have one more. I mean, this is, and you, everybody but me probably knows this because I came in late. But was this a convenience sample? I mean, how did you get the sample? You know?
Yes, this was a convenience sample. So we used non-probability, convenience, and quota sampling. We collected data on our own within or by accessing networks that we had. So we sent out emails to community organizations, etc., to get participation. And then we went to Qualtrics and used Qualtrics research panels by giving them quotas. So we did say that we want representation across the US. So they did have quotas by region. We had quotas by gender, and we also had quotas by race. So we did quota sampling on that front and convenience on our end.
I know it's a technical term, convenient sample. It's always made me giggle a little bit because I think it implies to non-technical folks that it's somehow the easier way to go. But if ever that was more or less true during COVID, I don't think any sampling anywhere, whatever the technical term might be, was convenient or easy. Question for you, like what's next? What do where do you go from here? What if we are really coming out of COVID pandemic level conditions? What would your hopes be for further research in particular?
Yes, thank you, David. Great question. And I will respond briefly, but then I'll also, invite any responses from Susan, who's actually working on a lot of projects with me, and Igor Mal, who's also doing the same, if there's any additional thoughts. I think in terms of our next steps would be to sort of write up some of our reports, obviously continue with community presentations. We do have a lot of presentations sort of coming up in the future with different community agencies. And then our bigger focus would be with Afghan refugees, which is becoming an important area right now, at least in the Chicago area, at least in the US. So we've been talking to some of our partners and learning from them. So we've been in conversation with people from Upnagar, Muslim Women Resource Center, Illinois Coalition for Immigrant and Refugee Rights, where we're also having conversations with partners in Tennessee and just sort of learning ways in which research community can actually support our incoming Afghan friends and family members. And then our next step would also be working on our bystander intervention, which again speaks to this idea of normalizing, gender norms and cultural norms, etc. And we're actually launching our bystander intervention as a fully online intervention sometime in March or April. So we'll definitely be doing that. And that will help with this idea of domestic violence or having more conversations around domestic violence. These are some of our plans, I think, in terms of so what or where do we go next with this research. Susan, is there anything, or Yigirmal, that I may have missed? Well, thank you. Hopefully that answered your question, David.
Yeah. Oh, I know there's always more work to be done. So I'm just curious where you might be headed next. So other questions or comments, reflections? All right, then, Ava and Irma, we'll leave it to you two if you want any final thoughts here. Teresa, anything else before I turn it over? All right, any final thoughts, comments from our two wonderful presenters? Thank you so much. This was really fascinating work.
Thank you so much. I actually did have a question for anyone. Is it okay if I ask? Okay, thank you. My question is just in terms of thinking about research and practice, are there any, David sort of talked about, how sometimes it can be inconvenient to actually collect data. And we're also seeing that in some of our conversations with, wanting to work with Afghan families, like let's not overwhelm them. We hear that a lot. So are there any, I guess, like best practices around data collection, or are there any like innovative strategies that the research community can think about, or from community agency or practitioner folks here on this call, if there's any ways in which you might want us or want researchers to collect data? Are there any sort of thoughts around that?
I've got thoughts, but I want to see if somebody else wants to talk. Oh, fine, I'll go. No, I mean, I think speaking from the Curl perspective, just this applies to often in our evaluation work in particular, mean, there's no way that you're going to completely do away with the added burden of that comes with the research evaluation, whatever the questioning is. Like it's going to be there, and I think kind of the first step is admitting that is an actual fact and being aware of it. I think Christine and Susan and Teresa and Yasmin and Mary and everybody else who has been or raised that curl can jump in. But I think the more that you can do to weave your research into the service provision kind of flow, so that it isn't okay, here you had to answer all these questions for service provision and do all these things and jump through all these hoops, many of them necessary, if not for bureaucratic reasons alone, for good reasons as well. The more that you don't have to have that, and then be like, okay, and here's a researcher that's coming in something that's largely disconnected. So the more that you can weave that in a partnership would be the way I would go. Nothing's going to be perfect. Nothing's going to, as I said at the outset, nothing's going to take it away entirely. There's going to be more time. You're going to ask me more questions. You're going to ask me to give up more of my time and so on and so forth. But the more that you can ask me as I'm coming through and working with the particular community agency, I think the better. I think it's also a win-win then for the community partner, for the service provider, potentially as well. So that would be one of the first places I would start.
I wanted to add my 2 cents that I totally agree with what David said on one hand, but another problem exists, which is that if you're trying, I mean, let's take DV for an example. If you're trying to really understand what's happening and how people are experiencing domestic violence to inform the kind of services and policies that are needed to address it, the problem is that very few people access those services. So I mean, that isn't the only place that people are at. So it also, to figure out all the other places and how to reach people in all those other places is just something that has to be done as part of that. So that's one piece of it. And the other piece, and this is almost going back again to, the question about the experience that we got in terms of the men experiencing domestic violence. And this is a plug for mixed methods, is that on one hand, I really think, that surveys are really important because they catch things and you get a broader group of people. And then I think you have to sometimes go in and do some more focused discussion, figuring out how this is happening and how people are experiencing it, and then take it back out again and say, oh, we see this. Now let's see if that is really it, what we got in that little piece. And that back and forth sort of iterative process of understanding what's going on. So one thing I say is like, having the ability to stay with an issue and go back and forth on it with partners to really understand what's going on, and then is going to be really important.
Thank you both.
And I'd like to add something. So I'm Mary Rojic. I'm a former Curl graduate fellow. I did follow instructions.
unlike yours truly, Mary.
And
as Teresa said at the outset, we are the worst offenders. But thank you, Mary.
I don't actually have a specific answer, but it's more something to think about. And that depending on which immigrant community you're working with, thinking more deliberately about the educational level of people in the community and the cultural differences. And so I think like a lot of people, for example, will not have an understanding of what research is at all. And I'm not sure that I'm not sure that you'll actually be able to explain it to everybody. This insight, I guess, comes from my parents were immigrants, and a couple months before my father's passing, he asked me what I did, and so I told him I did research, and he didn't get it, but no, he asked. It's just such outside of people's frame of reference that they really won't understand. So there's different aspects of that. One is then I wonder if they would experience a level of coercion in participating, because here's yet another person who looks official, then I have to do what they tell me to do, versus being distrustful and not providing accurate answers, if that's how things worked in their home country of origin, right? So there's all sorts of complicating issues when you're doing this kind of work, and I just think you need to be aware of what those might be.
Yes, thank you. I think that's really important and really powerful, and especially important when thinking about community-based participatory research. So really making sure we're meeting the community where they're at versus, asking the community to take a leap of faith and be like, come do our research with us. So I think it's really powerful. Thank you so much.
I also want to jump in a little bit, if that's okay. I'm Yasmin. I'm staff here at Curl. Thank you, Alba, for the presentation. I also wanted to kind of bring up more of the what you're asking about, like being culturally responsive and things like that. And I know with some of our work, like I've been doing work with Heart, and we've been doing work with Muslim communities and thinking about how to be culturally responsive with our own population. When us as researchers, we also are from that community. But just what I've kind of learned is, building those relationships with folks that are working with the community that you're working with, who are also like probably share identities with the people that they're serving, and really just building that relationship to understand like what are the different cultural aspects, religious aspects, traditions that they're coming with, and taking that time to learn about them and build those relationships with them and building that trust. And then, yeah, as folks were kind of mentioning, like being really transparent about what the research is and what you're going to do with that information, how it could potentially help them. All these different things need to be, need time, and they need you need that time to build that trust. And I know when we were doing work with Muslims, like it's going to be a similar thing where you're not going to find a lot of literature around best practices, or I know I was able to find maybe one article about Muslims and things to consider when you're recruiting, things to consider when you're trying to how you ask questions, whether surveys or interviews would be helpful, all these different kind of just factors that play into the research process. I think I'm hopeful that there's more researchers of color also that are doing this kind of taking notes on these things and writing articles about them. And I think there's probably going to be more of that coming out now and recently. So really taking time to dig into that kind of section of literature and seeing if there's things out there for the different communities that you're going to be reaching out, and being really thorough about it. And then if there isn't, again, taking that time to build those connections with the folks that you're going to be interacting with. I think it's harder when you're doing a larger survey that's national, of it could be anyone and so many factors, but if you're going to start doing more of these like smaller presentations and things like that, like, you know, taking that time, I think is really, really important so that there isn't harm that's kind of coming through the research process and how you're sharing the information and things like that. And then that'll set you up for next studies and things like that, I think. Just just some experiential thoughts that I wanted to share around that.
Thank you so much. Susan, I know you had your hand up earlier.
It's not going in the same direction as what Yasmin just said, but you know, I think the biggest issue or rub or whatever, I mean, I'm a big proponent, having done most of my research through Curl, of community-based research, obviously. But I think, you know, the dilemma or the issue that gets set up, and maybe this speaks to Christine's point about, you know, different combining methodologies, is that, you know, you don't get, and I'm not sure that you need to get, but you don't get like big, broad, like sort of survey pictures of what's going on out there, because you don't have these huge samples that are random samples that sort of you can sort of look at, you know, what do they call it in health, like, you know, the indicators of sort of what's going on. But I think, you know, that's the downside. But, you know, on the other hand, it's sort of like, what do we want to do with our research, right? And if we ultimately, I mean, it's all fine and dandy to talk about, you know, the extent of domestic violence and who's being affected. And there are data out there that exists. I mean, the Criminal Justice Information Authority has lots of data on who's using services, which isn't who's affected, but, you know, who's using services. And Christine has worked with those data, as have I, you know, and added to them in other ways to sort of broaden the picture. But you do lose. I mean, that's the downside of this, is that you lose a broader picture of sort of incidents and sort of larger descriptive sense of what's going on. That's not necessarily bad if your intention is to, you know, help service providers provide better services, right? It's a little bit harder in terms of prevention, like, you know, how do you design prevention stuff? But not necessarily either that, but I just sort of want to throw that out. So.
Thank you. I know we only have 3 minutes and I've like kind of taken over this conversation. So thank you so much, Curl, for providing us the opportunity and this really wonderful platform to, you know, share our work. I really enjoy working with Curl and I learn so much every time. So thank you all for making the time. I know it was long, but thank you so much. Yigarmal, any final thoughts?
Thank you for staying with us throughout the whole conversation. One final thought I have is, like, whenever we, as researchers, whenever we go to the community to do research, merely by framing the research question, by devising the indicators, we are setting the research agenda, and we have to stay mindful of that. And I think another way that we can look at research is by looking at how it means for the communities that we're studying, by the people who are actually being studied. And one thing we can incorporate that interest, genuine interest, and elevate participation to some meaningful level could be by creating a research capability with service providers, and by creating a system where the participants can create the research agenda. Of course, it's not going to be a survey right away, but at least we can generate hypotheses. At least we can find out where we can look into, because right now most of it sounds like we are setting the agenda, we have the indicators, we have the things that we know what we are looking for, and that may not necessarily be the thing they're looking to show us or they're wanting us to see. Thank you so much.
Thank you. A point near and dear to the hearts of all of us at Curl. Thank you. It's a great way to kind of wrap up our session. Again, thank you both, and thank you all for joining us. And we'll hope to see you all soon on Zoom or in person.